How diabetes affects the skin. Diabetes can affect various parts of our body, including the skin. Some skin changes appear in the later stages of the disease, but others can be early indicators of diabetes. In fact, skin problems are sometimes the first sign that a person has diabetes. Certain skin lesions are typical in diabetes, while others can occur in anyone, but are more common in people with the condition. Let's discuss these signs one by one. Acanthosis Nigricans. Have you ever noticed a dark patch or a velvety band of skin on the back of your neck? This darkening can also appear in the armpits and groin area. It is commonly seen in overweight individuals. The medical term for this condition is Acanthosis Nigricans, and it is often a sign of high blood sugar levels. In some cases, this may be the first indication that someone has diabetes. If you notice this type of skin change, consult a doctor. Early detection of diabetes can help prevent future complications. Skin tags. Many people have a few small skin growths, which are normal and harmless. However, having numerous skin tags, especially with a darkened color, may indicate high blood sugar levels. These growths are most commonly found on the eyelids, neck, armpits, and groin. Necrobiosis Lipoidica. Have you noticed yellow, reddish, or brown patches on your skin? This condition often starts as small, firm bumps that resemble pimples, which then progress into hardened, swollen areas. The surrounding skin may take on a shiny, porcelain-like appearance with visible blood vessels. This condition can cause itching and pain and tends to go through cycles of activity and inactivity. The medical name for this condition is Necrobiosis Lipoidica. If you see this type of lesion, it's essential to get tested for diabetes. Skin thickening. About 1/3 of people with type 1 diabetes develop a condition called digital sclerosis, where the skin becomes thick, tight, and waxy, especially on the back of the hands. Finger joints may stiffen and become difficult to move. In some cases, this condition also affects the toes, forehead, knees, ankles, or elbows. Managing blood sugar levels and undergoing physical therapy may help. Moisturizers can also soften the skin. Diabetic dermopathy. This condition causes small, depressed spots on the skin. It is quite common in people with diabetes and is known as diabetic dermopathy. These spots usually appear on the shins, but can also develop on the arms, thighs, trunk, or other areas. They do not cause symptoms, leading many people to mistake them for age spots. Unlike age spots, these marks may fade within 18 to 24 months, but some can remain indefinitely. Diabetic blisters, bullosis diabeticorum. Although rare, some people with diabetes may develop blisters suddenly. These blisters may appear as single large blisters or as groups of smaller ones, and are typically found on the hands, feet, legs, or forearms. They resemble blisters caused by severe burns, but unlike burn blisters, they are not painful. Eruptive xanthomatosis. This condition is commonly seen in people with uncontrolled diabetes. When these bumps first appear, they may look like pimples, but they quickly take on a yellowish color. They're most often found on the buttocks, thighs, creases of the elbows, or the backs of the knees, but can appear anywhere on the body. These bumps are usually tender and itchy. The good news is that they disappear once blood sugar levels are controlled. Frequent skin infections. People with diabetes are more prone to skin infections, both bacterial and fungal. Common bacterial infections include styes, infections of the eyelid glands, folliculitis, infections of the hair follicles, boils, deeper skin infections. Fungal infections are also common, especially in warm, moist areas such as under the breasts, around the nails, between the fingers and toes, corners of the mouth, armpits, and groin area. Common fungal infections include athlete's foot, jock itch, ringworm, and vaginal yeast infections, slow-healing wounds, and ulcers. Over time, high blood sugar levels can cause poor circulation and nerve damage. This can make it difficult for the body to heal wounds, particularly on the feet. These open wounds are known as diabetic ulcers. If you have diabetes, you should check your feet daily for sores or wounds. Itching, pruritus. Localized itching can be a symptom of diabetes. It can be caused by fungal infections, dry skin, or poor circulation. When circulation is the cause, The lower legs are usually the itchiest area. You can relieve itching by reducing how often you bathe, especially in dry weather, using mild soap with moisturizer, applying skin cream after bathing. If you notice one or more of these signs, it's important to consider other risk factors such as obesity, a family history of diabetes, or a sedentary lifestyle. A single symptom alone does not necessarily indicate diabetes, as these skin changes can be linked to other conditions. However, if you're over 40 and fall into a high-risk category, it is wise to monitor your blood sugar levels regularly. Early detection of diabetes and preventive measures can help avoid serious complications in the future. That's all for today. Hope you liked this video. Don't forget to like, share, and subscribe to our channel. Thank you.